And that's why people are angry. Oh, I think we have
another guest who wants in.
We have a guest who wants. Let's take a look. Oh, it's Dr. Gold, Dr. Simone Gold.
This is the John
and Ken. Yeah, this is the John and Ken COVID bubble.
Right.
We want to make sure we screen people first to see whether or not they can be welcomed into the safety of the John and Ken endeavor.
All right.
Opening the doors for Dr. Gold.
She is stepping into the airlock. Are we going to vote to admit her?
Is she wearing gloves?
I say yes. She's a doctor. Oh,
yes.
I don't know. Shouldn't she be wearing gloves and a mask?
No, you don't have to wear a mask to come.
Okay, fine. Okay, she gets the green light from me.
Good Lord, you're tough.
All right, close the doors, let her in. She is a certified emergency physician and Stanford-educated attorney. And the reason why we asked her on the show is she's the initiator of this MASH casualty incident letter that was sent to President Trump, signed on by more than 600 of the country's physicians to talk about the coronavirus shutdown and the negative health consequences from it.
Dr. Gold, welcome to the John and Ken Show.
Hey, how are you? So who's going to win the prize if I tell you if I'm wearing gloves or not?
It would make Deborah feel more comfortable if you were.
That's where we're going with the lockdown. It's even long distance. We need to be wearing things.
Yeah.
Yeah, and I heard a good quote from you that you're not in this politically. You just think this is a health situation that these doctors want to comment on. Can you explain to our audience what this is about?
Yeah, everybody's been trying to portray this as a political movement. It's been said that I'm a GOP operative, a Trump operative, and I just laugh. I'm like, well, nobody's called me and told me that. This is a grassroots physician organization that we got started because we're frustrated that the American public is not being told the full story of the health effects of the lockdown. Very serious health effects: depression, anxiety, suicide, and then the things you're not thinking of, like all the strokes that have been missed, all the heart attacks that have been missed, the fractures, and there's so many problems that we finally decided we need to speak up.
Yeah, and we just talked about that poll that 49% of Americans said they did delay possible medical treatment during this lockdown.
So there's no question. So I'm a board-certified emergency physician, which I heard you say. Thank you. It took a lot of years to get there, so I'm proud of it. But the census in the hospital was really, really low. I mean, I would say for close to 2 months, we've had maybe a little less than 2 months, about 50% census. I mean, literally 50% of the patients coming in are not coming in. This is also borne out by the statistics, right? So New England Journal of Medicine just published that 40% of stroke patients went missing. JACC, Journal of Cardiology, published the same thing. But I can tell you that firsthand witness. We're not seeing some of the strokes. We're not seeing some of the heart attacks. We're not seeing, and then all the things that have gotten worse. I had a patient who was due for a hip replacement due to bad arthritis. It was scheduled in March, and then she couldn't get it because it was considered elective. And so because of the pain, she just got more and more sedentary. And after about a month of doing not much but laying on the couch, she developed a blood clot in her leg, which then went to her lung. She had to be put on anticoagulation therapy, and that's where she is right now, laying on the couch with anticoagulation therapy. The surgery is still delayed, so she's in more of a life-threatening situation than she ever needed to be. And those are the kind of stories that are happening all over the country to all Americans.
And the mental health toll is heavy.
It's terrible. Yeah, so tons and tons of psychiatrists wrote to us. Calls to suicide hotlines have gone up something like 1,000%. I mean, just crazy numbers that you can't believe. We have one psychiatrist who was relating just a tragic story of a young woman he had for about 5 years, and she really had pulled her life together. She was not on drugs anymore. She was going to college and had a job. She was about 30, and she was clean for about 4 or 5 years. And then she lost her job because of the whole COVID lockdown, and then school, of course, was out, and she just got depressed. Like, her life didn't have the structure that it used to have, and she inadvertently overdosed. She hadn't used drugs for years, and she died. And he considers this his first COVID casualty, and that would never be considered a casualty of a lockdown. It's just not considered anywhere. And these are the kind of stories that have to be considered when we are talking about things like locking down the economy.
And how could we have done this differently? I realize that the big message that went out there with the economic shutdown was also the media and social media overloading us with the stats and the death and the scare stories. I think that's what kept people away from your emergency rooms. They felt like if I go there, I'm going to get this horrible virus. How could we have done this differently, if I could ask that?
Yeah. So for me as a physician, I was always concerned if we did or did not have enough ventilators to treat critically ill patients. One of the few resources that we could not deviate around if we needed it would be ventilators, right? If somebody needs a ventilator, they need it now. There's no substitute. So for me, that was always the question. That was the flattening the curve. Do we have enough ventilators? Once we had that, that was what we needed to ensure. But again, once we had that, everything else was not really necessary, right? That was the whole point. We're forgetting that was the point, was not to overwhelm the healthcare system. We're now in, I consider phase 3, really. And in phase 3, people are, they're very afraid. They were very afraid to come to the ER. They say, I'm sorry. Go ahead.
No, what I want to ask you is, since you're a doctor, there's medical doctors who are the main advisors for governors and mayors and county leaders. And they're the ones who shifted the goalposts. It was flatten the curve, and it was let's not overload the hospitals. Those problems have long been taken care of, right? The curve has been flattened here in L.A. County for weeks now. We never came anywhere near a hospital overload, not even for a day. And yet the medical professionals are still trying to extend these lockdowns and slow down the reopening. Why are they doing this? Because it seems that they're the source of a lot of this paranoia. And it's making everybody crazy because that wasn't the deal.
Okay, so you got me on a good day because I'm a little bit upset about things that are happening. I think the personal cost to physicians of deviating from the public narrative is very, very high. I think there's a very real chance that physicians who speak out lose their jobs or reputation. It's happening to me. There's a lot of social media comments that, oh, she's going to lose her job. Well, I'm like, no, I'm not. But I kind of, I feel like it's in jeopardy. And so I'm very cynical today on a Thursday. I think you should listen to your own doctor. So what I have to say is listen to your own doctor over anybody else. And that's, in fact, what I'm trying to do with the website www.adoctoraday.com is we're hearing from your doctor, people just like your doctor, they're going to tell you the cost of the lockdown because we feel as if your doctor is the one who'll tell you what is closest to the truth.
You're saying that there's people out there on social media, you just ignore them. You're just telling the truth. You're seeing what's happening. This shutdown is causing people to delay medical care and to have all sorts of problems, including mental health problems, by being locked up for so long. I don't know why that should be turned political. You're just telling it like it is.
So I'll give you a real story. It's really short. A patient came in about 2 weeks ago, maybe a week. It's about 10 days ago, and she's 55 years old, regular human being, right? She's just coming in. And why is she here? Because she was at home dyeing her hair because her hairdresser was closed. And if you've ever dyed your hair, you can't do it at home. It's very awkward, I think. But the hairdressers are closed. So she kind of turned around, she tripped, she fell, she broke her hip, and she broke her shoulder. So who's going to call this a cost of a lockdown? Nobody. But I'm sitting here and I'm talking with her and this is a cost of a lockdown. People are different. They're doing different things than their normal, ordinary patterns. And it's causing tremendous injury. Now, that's a pretty, unusual, I suppose, example. But this is all day, everywhere. There's hundreds of thousands of these stories. We're compiling a lot of them, and we're putting them in videos on the website. You can just go watch them. I've got no agenda other than to share with people what the actual truth is.
And here's what I'm worried about, that we're supposedly coming out of the lockdown, but I still think people are going to be hesitant to come to your emergency rooms because they're still going to be locked in with these fears that they're going to get coronavirus.
Oh, I'm so glad you brought that up. I meant to say that earlier. So the patients believe they're going to die, and this is very hard for me to overcome. So they come in, they're afraid to have it. Maybe they have it, maybe they don't. I give them the results if I think that they need to have it tested. And the moment I tell somebody that they're positive, you could almost see their face just go white. And I first have to say, no. You've been told it's a death sentence. Not at all true. Not at all true. And then I go through the science of it. If you're, don't have underlying pre-existing conditions and you're not a nursing home patient, you're going to recover from this overwhelmingly. People sometimes like to say that I'm putting a rosy spin on it. It's not true. Anything can happen to anybody. There are bad outcomes for young people as well. But people are walking around with the assumption that if they get this virus, they're going to die. If you look at CDC.gov statistics for yourself, you will see the statistics. And overwhelmingly, if you are healthy without multiple pre-existing conditions, certainly if you're younger than 60, right? But even people who are older than that, the vast majority recover. Not that it's a pleasant thing, and I don't want anyone to think I'm trivializing it. I've taken care of very sick people with COVID, but they almost exclusively were nursing home patients and patients with serious underlying diseases. And the second half of why I'm doing this is I'm furious furious at how we treated our nursing home patients in certain states. New York, of course, comes to mind. But we just threw them in the trash is what the policy decisions were. They sent COVID-positive patients back to nursing homes, but then flew through the nursing homes. And I would see one patient after the next with the nursing home patients, and it was tragic, and we should never allow that to happen again.
All right,
Dr. Gold, we appreciate you coming on.
Thank you.
Well said.
All right.
Hi, Dr. Simone Gold is a board-certified emergency physician and Stanford-educated attorney.